I wish I could clone you. I only tell a handful of patients this. I wish I could really clone you for this, because it's just been such a pleasure taking care of you. You know, just such a wonderful, personable, just beautiful person on the inside. And we were talking about what was bothering you. What were your motivations for thinking about this for, what, 5 years you were thinking about it?
At least.
Because you felt like the outside didn't match the inside.
Oh, for sure,
so
yeah.
Tell me about that.
I think there was a level of, there's a bondage that you almost feel. There's restrictions. You know, you have this, I'll speak for myself, I have this big personality, right, that fills the room, but I would shrink because I didn't feel like my appearance matched that light.
Mm-hmm.
And you gave it to me, Dr. Rad. Like, I can walk into a room now, you know, like I said, I barely wear makeup anymore. Just mascara and lip gloss, and I walk into a room and own it because of you. So I am forever grateful, truly.
Oh, well, it's such a pleasure to hear this. I mean, this is really the moment that I look forward to, seeing patients through, you know, it can be a bit of a challenging process, and getting them through safely, all the healing and all the recovery. And then enjoying that moment where we can look back and compare the before and after together and see just a transformation, but in a way that looks natural. You know, we were talking about, wow, before and after together, what a difference. But you take the before picture away and you just look at the face looks fresh and energetic and youthful and all those things we like to see, but no one would have any idea that this top to bottom surgery was done and the person looked like the before picture because you look natural. So what are your thoughts as far as, you know, what your goals were? Or maybe tell me about what your original goals were and how did we talk about achieving those goals?
Well, interesting enough, I lost a bunch of weight. I've lost over 100 pounds before the surgery. Yes. Wow. And I really came to you just because I wanted to get rid of the double chin. I mean, it was paying rent. I had it for so long, you know?
That was the initial motivation.
Absolutely. And I mean, you completely exceeded anything I ever prayed for, right? Because going into this, I came into this praying about it because it's scary, all right? There's so many plastic surgeons out there who are promising this and saying they can deliver this. And so I did my research and found you, and honestly, you exceeded anything I could have ever imagined. I mean, it's funny because when people see me, they think it's the weight loss. And I often have to say, no. Let me show you who the magician is behind this. This is not the weight loss. And then I'll show them the before and after. And it's interesting because most people's reactions is the same, oh my goodness. And I'm like, yeah. And then I get excited and say, look, no scars. Because the scarring, there's just hardly nothing there.
Right.
And that's without any special creams or anything, you know, just you did such a good job that there isn't any residual of what you did.
Yeah, well, no, it's a combination of really meticulous surgical technique, of course, right? The surgeon has to be very experienced in knowing the vectors and the direction of lift and how much lift and where to place the tension, how much tension, closing the incisions with no tension on it. I mean, all those little details that just come with the depth of practice, but also, you know, good healing ability, following instructions, which of course you have both. You're genetically programmed to heal scar as well, but the combination of the two can lead to beautiful, refreshed results and beautiful appearance of the scars. So actually, can we do a little close-up of the scar? So let me come a little closer here and turn there. So scar pattern starts actually right there and curves around your sideburn. Okay, you can kind of see right tucked underneath those little hair follicles to the top of the helix, the root of the helix of the ear. Curves around this natural curvature. I routinely put the incision behind the tragus to have an opportunity to hide it, and then curves around the earlobe, and then behind here, actually you can kind of get a sense right in the natural crease of the ear, and then curves across and then down the hairline, disappearing into the hairline. Only 7 months, and this is looking really quite good. Turn this way, let's see this scar. Yeah, same thing here. starts at the top of the temple, curves around to the top of the helix, curves around behind the tragus. A lot of surgeons place the incision line in front of the tragus, and that's okay if there's a clear difference between the cheek skin and the tragus skin, which for you there was not. So therefore, it's a good opportunity to hide the incision behind the tragus, and we have nothing in front. So that's excellent. And then it curves around the earlobe, behind the ear, and then down, turn a little bit more down the hairline right here, and disappearing into the hair. So respecting the fact that the tragus and the earlobe are tensionless structures, meaning there's nothing pulling on the tragus, there's nothing pulling on the earlobe. And so it's so critical that the tension of the lift is held by the deep plane, the muscle fascia layer. And when it's held by that strong foundational layer, then the skin can just re-drape in a way that has no tension on the tragus or the earlobe. And when there's no tension, then we have a beautifully healing scar, just fading away. I can barely even find it at this point. And also the position and structure of the tragus, position and structure of the earlobe is preserved, meaning there's no pulling down, there's no ear canal show. Thank you for letting me do the show and tell there.
You're very welcome.
But what you were saying about feeling restricted, like a bit of a bondage, where you lost 100 pounds, there was a lot of laxity and looseness throughout your entire face, especially in your neck, and it just saps the life out of people. Tell me about that.
You just almost feel like you are in prison in your own body.
Yeah.
Because you're walking into these rooms and you feel ashamed almost. And you know, I've said, you know, what I would wish for every person, woman and man, is that when you feel like that, if you have the ability and the means to change those things, do it. Because once those shackles fall, and you know, you're fortunate enough to come across somebody like yourself that can assist you with those things, your life changes.
Yeah.
I mean, everything about, even my business, everything about my life has changed because I'm showing up differently. Yeah. I'm showing up confidently, which allows for people to believe me when I speak in these rooms, you know? And it's just about what I'm projecting. Again, the personality has always been there, but now I'm showing up with my head a little higher, you know, and my shoulders are back a little more, you know, and you did that. Thank you.
You're welcome. You're welcome. Like I said, I wish I could call you. Just experience this smile, you know, 100 times over. I would love it. But yeah, it's all about tasteful, artistic, safe, ethical surgery. And we see so much distortion in plastic surgery, which gives people the wrong impression of what plastic surgery is. And so I hold myself to such a high standard, just internally myself, and high standards set by my professional societies. I adhere to those, of course, as well. Trying to give patients like you that internal confidence that comes with having an outside appearance that reflects what you naturally have inside. And you're such a strong person. I could tell right off the bat. I could tell, wow, she has a confidence. She has a stability. She has such a positivity on life. And so it's just helping reveal that a bit more.
Yeah, that's good. That's good. I appreciate it.
What does your family think? Friends and family?
Oh, they're in awe. It's the funniest thing. So they're like, oh, you look great, you know. And again, a lot of people contribute the difference to the weight loss. So they're like, you look great. You were beautiful before. And I'm like, oh no, let me show you the before and after. And then I whip out your video and I show the before and after. They're like, oh my goodness, what a difference. And you can't deny the difference, you know. But again, to your point, if I don't point it out, no one knows because it's so natural. They have no idea. I have to say, here's the before and after, and then they're like, my goodness, when did this happen, you know? But it's so naturally done, it's so tastefully done, and I mean, honestly, magic is all I can say.
This is music to my ears, you know, and yeah, it's naturalness, naturalness. My philosophy is natural, timeless artistry. You know, it's really just about bringing out what patient's vision is. You know, so we were actually talking about your initial consultation, how your neck was the focus. That made sense because your neck had the most laxity and looseness. Yeah. But because everything's connected, from top to bottom, you and I talked about this idea of harmony and balance. Yeah. Right? If I had only given you this kind of neck, jawline contouring and definition and everything, but your upper face didn't quite balance, or you know, if I didn't do any of the brow lifting and the shaping and improvement in your upper face, then it looked kind of odd.
Right.
Remember that conversation where we were talking about that? Because it's a common thing for people to think, oh, you know, I just want this gone. I just want that type. But then it sets up for the face not kind of looking in synchrony.
Right. That's good. I remember that conversation, and it's funny because I had no idea. To your point, I was coming here to get my jowls and my chin taken care of. Right. And then when you took the time with your warm self and sat in that room and explained to me, Damaris, these are the things I suggest, and here is why. Yeah. I said, let's do it, and I'm glad you did, because had you just gone off of what I thought I needed, and I don't know that, you know, these people will be seeing this before and after they screaming the way they do when they see it. You know, it was just so well done. Your knowledge and your ability to say, hey, this is what I suggest. You weren't forceful, right? You didn't make me feel like if I didn't do all of these things, or these things in addition to, then there was nothing. No, this is what I suggest, and I'm glad you did, and I'm glad you did it.
Yeah. I mean, thank you. I'm glad it resonated with you, and thank you for sharing that, because I really try very hard never to tell people what they should have if it's not even in their minds, or if there's not an open-mindedness to considering other procedures. Whereas, you know, you and I had a conversation. That's how I like to look at a consultation. It's not a one-way street of me telling, oh, you got to do this, that, or the other thing. I really try to listen first and see what's really bothering you as the patient, because that's going to be unique to you and as compared to somebody else. And then provide guidance.
Oh, that's good. That's so good. That's exactly what you did. It was definitely, you heard me, we had a conversation, you heard me, you provided guidance, and then you executed.
Oh, well, this is what I love to do. You know, when you, just like anything in life, when you really love what you do and you love...
And it shows.
That's great. I mean, it's just so meaningful to have these moments. I love, you know, coming back, circling back, and then we just enjoy the moment. And guess what? You're going to enjoy this for the next 15 to 20 years. You know, you do some proper maintenance and things, non-surgical maintenance, which is important to do. But this is a structural lift of the foundational layers. That's why you look natural. The scars and the ear contours and everything look very natural, and also the longevity is going to be there because it's all the foundation that's been shaped. It's not the skin pulling like they used to do it 30, 40 years ago. Unfortunately, skin pulling is still a thing that some surgeons do because it's easy to do. It's the wrong way to do it.
Yeah.
So I'm so pleased for you.
Thank you, Dr. Rad.
And thank you for sharing, because I think it's one of these things that people want to know, you know, not only patients' experience, but not to be afraid of plastic surgery.
The only thing I would have done differently is I would have gotten it done sooner.
Okay, that's great, because I was going to ask you, reading my mind, I was going to ask you what, if you could give advice to your former self, you know, what would that be?
Don't be afraid, girl, do it.
Do it, yeah.
Do it. It was life-changing for me, truly.
This is so great. Well, on that note, thank you so much.
Thank you.
Thank you for trusting me. You know, it's a big honor. It really is a big honor. Every patient to take care of. It's a big honor to have the trust to do surgery on your face. So appreciate that very much. I appreciate you And I'm so glad I could play a role in helping the beautiful you on the inside shine through. I mean, that's really what it's about.
Thank you. Thank you. Amen.
Amen. Excellent. All right, well, that was fun.